If you are pregnant or you've recently had a baby, this podcast is for you. I am your host, Kath Bequee, a physiotherapist working in women's health and mum of three. Inside my online program, Fitness Mama, I just love helping support women to care for their bodies during pregnancy, prepare their bodies for birth, and support their after-birth recovery, helping them feel confident and strong inside out during this important stage of their lives. In this podcast, join me each week as we dive into all things pregnancy care, childbirth and postnatal recovery, helping you through every step of the journey. It is absolutely possible to feel amazing and confident in our bodies during this motherhood journey, and I want that for you. Come and say hi to me on Instagram at @fitnessmama, and let's dive into today's episode. Hello and welcome back to the Pregnancy, Birth and Recovery podcast. So today's episode is fabulous. Initially I thought it was just for pregnancy and postpartum, but really this is for all women who are sexually active, because I'm chatting with the amazing Dr Raelia Lew all about different lubricants for pregnancy, postpartum, but really for all of womanhood. So Raelia is a board-certified reproductive endocrinologist. She's a fertility specialist, obstetrician gynecologist, director of Women's Health Melbourne, and co-founder of Ellechemy Intimate Wellness. So Raelia understands and knows all things lubricants. So in today's episode, we are discussing different types of lubricants available. We're discussing why and when to consider using a lubricant. And hint, it's not just if you've got issues, it's potentially beneficial for every woman who's sexually active. We're discussing particular, prescription lubricants that are available, which might be able to help with conditions such as pelvic pain, vaginismus, postpartum when there's estrogen depletion. We're discussing lubricants which might be helpful for menopause, for vaginal health, and when to use vaginal moisturizers versus different types of lubricants, because it can be a bit of a labyrinth in terms of it can sometimes be really hard to know what to use and when. And in this episode today with Raelia, she's really great at just explaining it, so it's really simple to understand. So I found this episode fascinating, and I trust that you will too. Raelia, thank you so much for joining me on the podcast today. I'm really excited to chat to you about this important area that I think probably isn't traditionally discussed as much as it could be or should be. So thank you for joining me.
It's a greatest pleasure. Thanks for having me.
As I mentioned in the intro, today we're discussing different vaginal health, and there's a big array of different lubricants on the market. We've got lubricants for pelvic pain, we've got lubricants for pregnancy, for postpartum, with menopause. So I'd love to really, it's great to chat, because let's just start at the basics. When do you think women should be considering using lubricant?
Look, women should consider using lubricant from the time they become sexually active, because it can improve their sexual experience and pleasure. But a lot of people think of lubricant, instead of as a tool in their toolkit, as a medication, or even as negative, because it's contextualized with some kind of deficiency, that women think they should lubricate naturally, and that they shouldn't need it. And I would encourage women to consider lubricant as a tool to improve their sexual pleasure and their experience above and beyond what nature can provide, rather than seeing it as something to treat a disease or a deficiency.
Yeah, right. So you're suggesting there's a potential benefit for being proactive and trialing it, even if you're not experiencing the typical symptoms of. Actually, that's my next question. So you're discussing being proactive rather than reactive in nature.
Yeah, definitely.
Yeah. Okay. Well, that leads me to the next question then. What are the symptoms that someone might experience? So apart from just using it proactively, like we just talked about, to enhance and improve the sensations, what are some definite, I guess, red flags that we should be considering using it?
Well, look, as you know, I developed a lubricant range called Ellechemy, and our range of lubricants are designed to be intimate moisturizers as well. And a lot of people do need skincare solutions for the vulva, particularly if they've had laser hair removal, because that's very, very common. And with that change of fashion, the labial skin doesn't have natural protectants that it would have if it was hair bearing. So we see a lot more friction, irritation. We also see a change in the skin integrity and fragility, and that's because the skin has no natural protection, and also the laser actually works by zapping the glands and the hair shaft. So it causes the skin to be more dry as well as more fragile. So I think quite often, just as a baseline part of daily care, women who've removed pubic hair permanently do need a moisturizer. And a lot of people present with just chronic irritation to their gynecologist, and there are some pretty easy solutions by integrating a vulval skincare product. We also designed our lubricant range at Ellechemy to be really creating a lube for all seasons of a woman's life. So we do have some prescription products and some non-prescription products. And with our prescription products, we've incorporated elements to try and enhance female pleasure, either recreationally or in menopause, or to treat other conditions, not as a medical therapy for those conditions, but as an adjuvant therapy to try and improve women's life experience. And that's things like conditions associated with vaginismus or with pelvic floor overactivity for other reasons, or for pain related to conditions of a gynecological nature like endometriosis, where there can be secondary sexual problems. We
Yeah.
also know that every single woman goes through menopause, and for the decade prior to going through menopause, we have this decade that we call perimenopause these days. In the old terminology, it used to be called pre-menopause. Now we say peri. But really, gradually, our estrogen exposure reduces in volume and frequency, and in terms of our vaginal and vulval health, our skin changes, and so we are more prone to requiring a moisturizer, and particularly even with kind of adequate sexual stimulation of a both physical and also kind of cerebral nature, we might not lubricate in the way that we used to, because the vaginal skin does change with the changes of perimenopause and menopause. So I think every woman needs a lubricant at from at some point in her life, as an essential, as a must rather than a maybe. But I
Yeah.
think every woman could actually enjoy sex more with a lubricant. And I think many don't understand that, because when they've tried products that aren't beautiful and don't feel kind of gorgeous to the touch. And when we designed our products, we really took great inspiration from advanced skincare solutions to create something luxurious for women.
Yeah. Yeah, amazing. And you've got an estrogen-based cream on prescription. Can you explain when, because I know you mentioned it before, but when you might consider an estrogen-based lubricant or moisturizer versus a standard moisturizer?
Yeah, so look, estrogen vaginally can be used also as a prescription therapy, and many people do use that in menopause, even if they're not using a systemic hormonal replacement therapy. But other times in life where it might be really useful is if women have a low estrogen for other reasons. They might be, say, for example, on the oral contraceptive pill, and so their estrogen levels are a little bit lower than as if they were ovulating. And the other times where things can be a little bit low is when you're breastfeeding a baby after you've given birth and estrogen is low for quite some time, if women are fully feeding. And sometimes they'd get a little bit of estrogen deficiency in the skin, and that causes skin fragility, and they can really enjoy the improvements. Same with a little bit of topical estrogen. It's very safe. All of the studies that have shown kind of estrogen used even in high doses topically in hormone replacement therapy, none of them have shown any increased risk of things like cancer or blood clots or any other concerns that we sometimes worry about when using estrogen in an oral form. And certainly it's very safe.
So, would you say most, if not all, women postpartum are a bit estrogen depleted? Would you therefore recommend, and I know this is a bit of a blanket statement, but all women may benefit from estrogen-based cream, vaginal cream,
Well, I think
postpartum?
it's something they could try if they felt like it might help them. And you could argue that it might help with certain things like healing of tears and potentially healing of episiotomy, wounds and scars after the first instance.
Yeah.
And that often causes sexual discomfort for women.
And it can help with pelvic floor symptoms too. So prolapse
Definitely.
symptoms and urinary symptoms. So I've seen great benefit in the clinic. At what stage postpartum? So for a new mum's, she's home with bubs. You know what it's like with new babies. You know, having a meal can be challenging, let alone going to the doctor and getting a prescription for this. At what stage would you recommend for these busy mums, if they were going to try it, when would be the best stage to try it? Did you know one of the best ways to support your postpartum recovery is through exercising carefully during pregnancy and preparing your body for birth? And this is something we cover inside Fitness Mama. This is what fitness is all about with its physio-created workouts. We help you support your changing body during pregnancy, whether or not that's with pelvic girdle pain-friendly workouts, whether or not that's with strength training for pregnancy or pregnancy yoga. We help you to prepare your body for birth and reduce your risk of 3rd and 4th degree perineal tears and episiotomy. And we help to boost your postpartum recovery, whether or not you've had a vaginal or a cesarean birth. If this is something you want to do, then come and check out our free 7-day trial. You've got nothing to lose, everything to gain. And at the end of the day, it's all about helping us have a better motherhood experience to help us feel stronger inside out in every aspect of our life: physical, mental health, confidence. Anyway, I could keep on going, but come and check out the link in the show notes and join our free 7-day trial. See you soon.
They should try it. Firstly, I would say most women wouldn't become sexually active before about 6 weeks postpartum. And I don't think most women would want to put any cream on the vagina or on an early healing episiotomy scar or tear until that time. So, but I think any time after that would be fine.
Yeah. So the 6-week check might be a great time to discuss with a healthcare provider.
That's right.
Yeah. Fantastic. Now, rewinding a little bit, I'd love to chat more about pregnancy, lubricants for pregnancy. You also mentioned the vaginismus, which can be really common. So I guess I've got 2 questions here. It can get confusing I know, like speaking to friends and patients, it can get really confusing knowing what type of lubricants to use for what situations. For example, if you're using condoms. There's certain lubricants that aren't appropriate. If you're using silicone-based sex toys, it's another set of lubricants. So can you quickly, I just clarify what type of lubricants can be used when?
Yeah, sure. So, look, most condoms, most lubricants will be fine. And certainly we in our range have a silicone base and a cream base, and both are condom safe. But in terms of silicone, I guess it's kind of like poles repel. So if you're using silicone sex toys, you shouldn't use a silicone lubricant. If you're using, say, for example, silicone dilator wands, you shouldn't use a silicone-based lubricant because it could degrade the silicone of the product. So that's really the clue. Silicone's a really great lubricant base, and we have a serum, a silicone serum, which feels beautiful. It's very slippery, and that can be really helpful for women who have severe dryness. And it can also be really fun, and people can use it for different things like water play. You can use silicone lubes and they don't wash away. So there's lots of different applications for silicone lube. Not all sex is vaginal, and silicone lubes can be preferred for anyone who's interested in anal sex. A lot of men who have sex with men prefer silicone lubes. And in terms of aqueous-based products, our aqueous lube is a really beautiful moisturizer. So it sits as a beautiful barrier cream and beautiful moisturizer. And kind of that I would say is a better dual purpose product as a daily moisturizer and a lubricant. There are different types of lubricants that people can use. Some people use oils. The problem with oils is, and any wax-based lubricant, any oil-based lubricant, is it will stain, it will leave a residue. Often people complain of staining of sheets and things like that. So I wouldn't necessarily favor an oil-based lubricant because of that.
Yep.
And also because of the fact that it's much harder to balance pH
Yep.
in oil-based lubricants, but people do sometimes prefer them.
So perhaps if it's someone's first time, you would perhaps suggest a water-based lubricant that can also act as a bit of a moisturizer. It can work with condoms, and it's a bit of an all-rounder. Is that right?
Well, that's right. And one of our lubricants that we have is called Protectility. That's a lubricant that I would say is our designs are to help people when they're trying to get pregnant. And it's sperm friendly, but it's also a really beautiful go-to. And in the cream base, it's a really nice lubricant and daily moisturizer. And it's good for kind of young women who've had that problem of laser hair removal and just want a beautiful cream moisturizer that doubles as a gorgeous lube. So I would say that that kind of lubricant would be a go-to. And then, women at different phases of life, for example, in menopause and later on, might want something very deeply enriching and moisturizing. And sometimes in some of our products, we add other active ingredients to try and make the cream thicker and to make it a little bit more of a barrier cream function to protect the skin barrier even more powerfully. And so I think it's about, kind of trying things out and seeing what people enjoy, because lube's also about texture and sensation, and there is a personal preference element to it as well.
Yeah. You've just reminded me of something I'd love to get your thoughts on. As pelvic floor physios, there's a particular brand that I think is quite well, we've often recommended it. It's an olive base. It's got a bit of a beeswax base to it. But recently, we've learnt that this is an antibacterial lubricant by nature, which isn't necessarily what we want to be putting, because bacteria is a normal part of vaginal health and balancing our pH and all the rest. And we're not necessarily wanting to put things that are antibacterial in that area. Have you got a comment on that without mentioning names of products?
Look, I wouldn't comment on specific brands, but what I would say is that, when we talk about lubricants, we're talking about enhancing nature, but not disturbing nature. And, you can have ingredients that are essentially, people think of as natural because they are made in the natural world.
Mm.
For example, honey is made by bees and,
Mm.
things like that. And, kind of oils are often from plants. And but it's not natural for those substances to be in a person's vagina. And I did quite a popular blog on coconut oil because people often use coconut oil as lube. It's like a bit of an urban kind of tradition. And coconut oil is terrible to use as
Mm.
lube. It's the complete wrong pH, and it can really cause, a lot of flora
Yeah, okay.
dysbiosis. So it
Yeah.
certainly shouldn't be used as a lube. It's a food, not a lube.
Yeah.
But so I think, beware of claims of things being natural. I think we have to think with a scientific lens, and we have to analyze with the lessons of kind of physiology and
Mm.
think, well, what does the vagina need to be healthy? It needs to have a negative pH. Because that is what encourages our natural protectors of the vagina, the lactobacillus, to flourish and dominate. And that is your best protection against dysbiosis or changes to the microbiome that are negative. So when pathogens need a niche, bacteria and yeasts and fungi and any bacteria that's not really meant to be there, it's only going to flourish if there's a niche. And the lactobacillus, makes the lactic acid, which is very important in vaginal health and self-cleansing, and it also needs to be strong so that other bacteria don't get out of hand, and so there isn't a niche. So any kind of disturbance to the flora, anything that kills the natural bacteria, anything that makes the pH too alkaline, because that also causes disturbance in the good bacteria, is going to be a negative overall effect. So whenever designing a lube, it's really important to make sure that it's got the right ingredient combination so that the pH is ideal.
Yeah, love that. What made you, so from being a gynecologist and fertility specialist, at what stage did you start to think, I'm going to develop this product?
Well, I can tell you, I actually was working in the menopause symptoms after cancer unit at the Royal Women's Hospital at the time. And I used to treat a lot of patients with fertility preservation in the context of a cancer diagnosis and then follow them through, often breast cancer, which is unfortunately quite common in young women, but other cancers as well. And what I really got to think about, and my patients who I had in front of me were young women who were sexually active and had relationships and were concerned about fertility and future fertility, but had to deal with this terrible problem. They not only had the cancer that they often had to have treatments like chemotherapy for, which in itself causes skin disturbance, vaginal disturbance, but
Mhm.
then also afterwards, they often had to be on medications to prevent their cancer coming back that blocked their hormones. And that meant that they had kind of like a chemical menopause induced.
Mhm.
And so really they basically got plunged into
Mm.
essentially menopause, not gradually like it happens to most people, but just all of a sudden. And I realized how deficient everything that I had to offer them was in terms of the lubricants that were designed at the time. And then it really got me thinking, and I thought, well, why don't we have beautiful lubricants? We go to places like Sephora and Mecca and
Mm.
buy beautiful combinations of moisturizers for our skin, for our hands, for our body, for our face. Why don't we have beautiful lubricants? And
Yeah.
I really just thought, well, it's because no one's really even just turned their mind to it. And then, kind of being a creative and also being a doctor, I thought, well, how can we use actually principles to take it one step further? And are there lessons that we can learn from therapeutics and from pharmaceuticals that could enhance the
Mm.
female sexual experience? And really it occurred to me that even though lubes are for the vagina and vulva, there hadn't really been a feminine pleasure lens put to their design.
Mm.
And I guess a lot of lubes were designed to facilitate penetrative sex from a male
Mm.
perspective, and I really wanted to think about it from a feminine perspective. So
Yeah.
that's really how that was really the light bulb moment of our
Yeah.
brand. And I sat down with my very good friend who's actually a compounding pharmacist, and I said to her kind of all of this, and how can we design this together? And she helped me design our formulations, which have evolved a little bit over time. But really, the crux of our brand, Ellechemy, is taking lessons from advanced skincare, lessons from gynecology, and a bit of a creative perspective on pharmaceuticals, and combining them to make unique lube products that really are for female pleasure. And it's really focused with a perspective on, how can we improve the lives of women?
Yeah, love that. I think traditionally lubricant, you go to the supermarket and very masculine branding and raspberry flavored and all sorts of, yeah. So I think I love your whole brand, and I know it's not about the brand and what it looks like, but it's like a breath of fresh air. Now I did, before we wrap up, there's a couple more questions because I am very fascinated with your prescription only lubricants. I think it's quite, yeah, this is amazing. So we've discussed the estrogen-based lubricant that you'd recommend, postpartum, for example, with dryness, whilst breastfeeding. I'd love to explore a little bit more how you can help women with vaginismus or issues with pelvic floor, I guess, muscle tension, and helping to support that side of things with your lubricant, and what's in that prescription? How's that different to
So
normal?
the normal lube, so it's still got our beautiful bases, and you can still choose silicone or cream. But our lubricant called CBD, which stands for Calm by Design, also has an active ingredient of cannabidiol, which is a cannabinoid derivative, and it is a non-hallucinogenic cannabinoid. And it basically, we say, provides the chill without the high of cannabis. And it's something that can be used recreationally. It can be used just to reduce the threshold of female orgasm. But it also can be very helpful for people who do have that sexual tension. And often with vaginismus, there's the physical cause and the also disconnect between the brain and the pelvic floor, and the ability to relax kind of with, I guess, control. But there's also this reflex, often emotional side of it, which it's like a vicious cycle, because when you've had pain associated with muscle tension, you then anticipate that sex is going to be painful, and that causes reflex muscle tension. So it's like this self-perpetuating spiral.
Yeah.
And so what we often need to do, and I'm sure you're very expert at this from a pelvic floor physio perspective, is we've got to work on the body and we've got to work on the mind, and we've got to give people confidence and help with relaxation. And one of the nice things that you can do, because we can compound to a silicone base, I think, for dilator therapy for women who do have vaginismus and who are trying to have the confidence to insert dilators themselves, so it's under their control, is that you can do it in a warm bathtub with our silicone base and with the cannabidiol preparation, and that can be really nice and very helpful because it helps the muscles relax. You can't but relax in warm water. And women often, like a lot of women, like water births and things like that for that reason, to help deal with those sensations.
Yeah.
So that's
Has it
really
ever
nice.
been used pre-birth?
No, look, we haven't done a lot of clinical trials in many settings like that, just because it's very hard. We're a very small, bespoke kind of brand, and really we've been really focused on individual care for women, and very local. And so we're not a big pharmaceutical company, and running those kind of trials is prohibitively expensive, but it would be amazing.
When you go into labor, pop on your cream before you start pushing. Yeah,
yeah, look, it's
fantastic.
creative. Maybe one day we can do that trial, Kath. You and I.
Oh, funny. Okay, and you've got a third prescription one, don't you? Which has got a bit of testosterone and sildenafil, which I don't know
Yeah,
what it is. Yeah.
it's Viagra. Sildenafil's
Okay, right.
Viagra.
Yep.
It's a vasodilator. So
Yeah,
it's also
okay.
got aminophylline in it, that prescription product. So it's a
Yeah.
combination of vasodilators, which means kind of topical drawing of blood to the surface, so
Mm.
engorgement,
Yeah.
and also testosterone, which drives desire. And so it's the idea of trying to again sensitize and drive desire from a
Mm.
female pleasure perspective.
Yeah.
And that can be helpful for some women who find it difficult to achieve orgasm or who have
Yeah.
a reduction in sensitivity.
Yeah. And it's all topical as well. So it's not a tablet that you ingest and systemic. So yeah, I think it's
Yeah, and all
fantastic.
effects are local and all effects are
Mm.
subtle, So I would never, oversell our products and say that people are going to have like this absolutely dramatic kind of mind-blowing effect. It's to subtly improve sexual function for women,
Yeah.
and happily have had beautiful feedback from our patients and customers,
Mm.
and it's one of those little cult products where people keep coming back and trying it again or trying different SKUs. And I'd
Yeah.
say there's not one SKU that's right for everybody. People can often try different things and actually enjoy them. So
Mm.
it's just like sometimes you feel like a Chardonnay, other times like a rosé.
Yeah.
So it's fine.
Yeah.
You can try.
Yeah. Yeah, absolutely.
Yeah.
Okay, so I'm just looking at my list of questions. I think we've pretty much covered everything. We've talked about different types of lubricants, the different lubricants we might use for pelvic pain compared to, postpartum and menopause. We've talked about vaginal health, when to consider using a lubricant. Are there any questions or is there anything you feel like we need to talk about?
Oh, look, the only thing I'd say in terms of Ellechemy is one of our other products, which is really popular amongst young women, actually has a little bit of boric acid in it. So that's often a thrush repellent, so to speak. And
Mm,
so sometimes people do get chronic thrush and it's hard to treat. And it is about just then, kind of fostering the love of the lactobacillus. So
yeah,
this has a little bit of a kind of, I guess, prebiotic function and some probiotic action as well.
yeah,
It's
right.
about the balance and it's about comfort. Often women who have a bit of vaginal irritation from having chronic thrush find boric acid very soothing, and it's just restoring again that negative pH to allow the lactobacillus to thrive.
Yeah,
And that can be very helpful. Some people get recurrent thrush also with the changes of the hormones of the menstrual cycle, more prone to getting it just after a period. So sometimes we can use preventers instead of having to rush to recurrent treatments, which can be less effective over time.
yeah, interesting. Vaginal, but vaginal, sorry, bacterial vaginosis can affect fertility and it can often be recurring. Um, I'm just interested in recently because I did read some recent research. It was actually a dear friend of mine that published it, so it's very exciting. Discussing how treatment has traditionally been for just the woman, treatment with different medications and whatnot, and how now they're suggesting treatment for the male partner will
Yeah.
help with these conditions.
Yeah, so there was a study, and basically what it did was it randomized people into treating just the woman or treating both partners. And what it showed was that there was less recurrence rate in the woman if both partners were treated with antibiotic therapy. So we now, I guess, have reframed bacterial vaginosis from a female imbalance to a sexually transmitted infection, even though it's not a serious infection that causes long-term damage of structures like chlamydia and gonorrhea, but it still can be passed back and forward. Another one that sometimes we think about in the world of fertility, and this is something that can be a cause of recurrent implantation failure in IVF, is colonization with ureaplasma mycoplasma, and they can be quite hard to culture. So if somebody has that, that's another one that sometimes we treat both partners to prevent kind of
Mm.
that ping pong ball effect of passing back and forward the same
Yeah, interesting.
condition.
But
Yeah.
not thrush like what you were talking about before. That's
Yeah, well, that's
traditional.
right.
Yeah.
Well, the thing is that we've just got to consider the physiology of the male versus the female reproductive tract, and that actually most conditions, like for example, Candida and thrush, it thrives in a warm, moist environment. And because male
Mm.
external genitalia has different skin, it's squamous epithelium, a lot of things that affect the vagina. The vagina's, that's why women are actually more susceptible to STIs, because the vagina is the biggest surface area and it's mucous membrane lined. So it's a more kind of easily invadable tissue.
Yep.
And that's why things like chlamydia, men can be symptomatic in the acute phase, but then they tend to present and get treated, whereas women can have these kind of infections that go deeper and more extensive into the pelvis and can cause fertility problems, block fallopian tubes, ultimately very damaged anatomy. So we are more susceptible. And so, our anatomy is different, which is why some conditions are more serious for women than they are for men.
Yeah. Amazing. Thank you, Raelia. You've been a wealth of knowledge, and it's been really great to unpack what can be a bit of sometimes overwhelming for some women. Where do I start with what lubricant? So, and different areas of vaginal health. So thank you so much for chatting to me today. I really appreciate it.
Oh, you're really welcome. I think the take-home message is, don't think of lube as like a punishment or something bad. It can be something for you, and it can be something that can actually make your life more pleasurable. And it's not to treat a disease, it's just to enhance a natural experience.
Yeah, brilliant. Fantastic. Thank you, Raelia. Thanks for listening to the Fitness Mama podcast, brought to you by the Fitness Mama freebies found at www.fitnessmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitness Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth, and strong postnatal recovery is something that you deserve. Remember our disclaimer: materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis, or treatment. I'll see you soon.